Okay, let's get started. Good morning, everybody. Lovely to see so many people here. My name is Lindsay Bernhagen, and I'm a consultant with Wisconsin After School Network. I've been working with them for about 3 years now, primarily on assessment, evaluation, and DEI related things. So, talking about social determinants of health to me is a huge uh, element of thinking about what equity is and how we sort of think about the systems that produce and reinforce the inequities that we see all around us. So I'm very personally and professionally interested in this topic. So it's really my pleasure to be hosting us today. So this is day two of the two-part series on whole child, whole family, whole community, social determinants of health. And I just want to make sure that we thank our partners here at the Marshfield Clinic Health System, and of course, the Wisconsin After School Network, and also the Wisconsin Department of Children and Families. We have a really exciting agenda today. I can't wait to see how much I learn, so I hope you all feel similarly. So just a quick overview of how today is going to go. Just a little bit of welcome content this morning, which you're sitting through right now. Thank you. Um, we'll get kicked off with our sort of our deeper content um, on social determinants of health and child functioning. We'll have little breaks between each of these because we know we have things to tend to in our real lives. We need bio breaks, we need coffee, etc. Then we'll be talking about housing and programming. We'll have a food insecurity panel, and then we'll close up a little bit before noon. So if you'd like, you can introduce yourself in the chat, your name, your role, your program, and location, just so we know, have a sense of sort of who's in the room this morning. So before we dig all the way into our presenters today, I wanted to think of a little bit about, well, what I like about the social determinants of health model is that it really focuses us on thinking about systems and the systems around our lives that sort of shape our experience and our access and our sense of belonging and what's even possible for us. And a system that we can talk about, or a way that these systems sort of manifest, is to think about systemic racism. This video circulated um, a couple of years ago, I think in 2020, when we were kind of having our large national reckoning with the way that racism still persists in the United States. But what I like about this video is that actually what they're talking about in terms of systemic racism in this short little video is some of the social determinants of health. So we can actually kind of see them play out in how they sort of shape the lives of these two boys in slightly different ways. So we're going to watch this short video just to kind of get us thinking about social determinants of health and equity and why this matters so much, why we have to think about these systems, why addressing stuff on an individual level only gets us so far, because the way the world is structured, really leads to disparate outcomes. So I guess it's only about 5 minutes long, I think. And if everyone can mute, that'd be great, unless you're speaking.
This is Jamal. Jamal is a boy who lives in a poor neighborhood. He has a friend named Kevin, who lives in a wealthy neighborhood. All of Jamal's neighbors are African American, and all of Kevin's neighbors are white. Because Jamal's school district is mostly funded by property taxes, his school is not very well funded. His classrooms are overcrowded, his teachers are underpaid, and he doesn't have access to high-quality tutors or extracurricular activities. Kevin's school district is also funded by property taxes, so his school is very well funded. His classrooms are never crowded, his teachers are very well paid, and he has access to high-quality tutors and lots of extracurricular activities. Kevin and Jamal live only a few streets away from each other. So how come they're growing up in such different worlds with such different opportunities for success? The answer has to do with America's history of systemic racism. To understand it better, let's look at what life was like for Kevin and Jamal's grandparents. Decades after the Civil War, many government agencies started to draw maps dividing cities into sections that were either desirable or undesirable for investment. This practice was called redlining, and it usually blocked off entire black neighborhoods from access to private and public investment. Banks and insurance companies used these maps for decades to deny black people loans and other services based purely on race. Historically speaking, owning a home and getting a college education is the easiest way for an American family to build wealth. But when Jamal's grandparents wanted to buy a house, the banks refused because they lived in a neighborhood that was redlined. So Jamal's grandparents were not able to buy a home, and because colleges could prevent them from attending through legal segregation, their options for higher education were really scarce. Kevin's grandparents, on the other hand, got a low-interest loan to buy their first house and got accepted into a handful of top universities, which traditionally only accepted white students. This opened up a wealth of opportunities that they were able to pass on to their kids and grandkids. Even as late as the 1980s, An investigation into the Atlanta real estate market showed that banks were more willing to lend to low-income white families than to middle or upper-income African American families. As a result, today, for every $100 of wealth held by a white family, Black families have $5.04. A 2017 study confirms that redlining is still affecting home values in major cities like Chicago today. This explains how Kevin and Jamal inherited vastly different circumstances. Unfortunately, the story doesn't end there. A big part of systemic racism is implicit bias. These are prejudices in society that people are not aware that they have. Let's go back to Kevin and Jamal. Against all odds, Jamal manages to be the only student from his high school to get accepted into a great university, the same one that Kevin and his high school friends are attending. But after Kevin and Jamal both graduate, Jamal notices that his resume isn't drawing as much interest as Kevin's, even though they graduated from the same program with the exact same GPA. Unfortunately for Jamal, studies show that resumes with white-sounding names get twice as many callbacks as identical resumes with black-sounding names. Implicit bias is one of the reasons why the Black unemployment rate is twice the rate of white unemployment, even among college graduates today. You can see evidence of systemic racism in every area of life. The disparities in family wealth, incarceration rates, political representation, and education are all examples of systemic racism. Unfortunately, the biggest challenge with systemic racism is that there's no single person or entity responsible for it, which makes it very hard to solve. So what can you do? The first thing you can do is work towards becoming more aware of your own implicit biases. What are some prejudices that you might hold that you're not aware of? Second, let's acknowledge that the consequences of slavery and Jim Crow laws are still affecting access to opportunity today. As a result, we should support systemic changes that create more equal opportunities for everyone. Increasing public school funding and making it independent from property taxes would be a great start, so that poor and wealthy districts can receive equal access to resources. Systemic problems require systemic solutions. Luckily, we're all part of the system, which means that we all have a role to play in making it better. Peace.
I'm going to stop sharing so I can see the chat and see more folks' faces. So those of you who are familiar with the social determinants of health model, I know we're going to dig into it more today. Which ones did you see mentioned in that video?
So housing discrimination?
Housing, huge. Yep. I wanted to add, there's been some recent research on racial disparities or racial bias in housing lending. So they were comparing, in the 80s, upper income Black families and lower income white families, and saying that lower income white families have an easier time getting loans. There was a recent research project that was done with it was NPR and some other research partner, some other university, I forget who exactly, and they were looking at the same thing in major cities across the US, and found that when white loan applicants, Black loan applicants versus Black loan applicants, Latinx loan applicants, Asian American loan applicants, Indigenous loan applicants apply to the same kind of house, same values, same debt to income ratio, same credit score, all that kind of stuff, white families were more likely to get their loans approved than families who are racial or ethnic minorities. So that's still happening. They tracked it across the US. Yeah, access to quality education, huge. Okay, well, hopefully that at least give you sort of a way to think about this as it shakes out in individuals' lives, these systems, and how they sort of shape our individual experiences, and also how they compound over time. That's another thing I really appreciate about this video, as we think about sort of intergenerationally what the access to resources can do over time, and how that sort of it has long-lasting effects. So even if we can sort of fix things, in the here and now, in the present, there's still a lot of sort of background and other sort of elements kind of surrounding the individual families that we serve that make those fixes kind of work differently depending on what the structures around a person are. Okay, so I think we're going to get ready to change gears. So I'll let our first presenters kind of gear up, and I'm going to introduce them. So pull up your slides or whatever you're going to do. So our first presentation this morning is, again, the social determinants of health overview and how they impact child functioning, which is going to be presented by many of the wonderful folks at the Lacrosse Area Family YMCA. Jenny Meldy is the Director of Community Outreach. Her passion for youth development and community outreach is the inspiration behind leading the Early Childhood Center, 15 before and after school summer programs, wow, food programs, a team of 4 community health workers, and the mental health director. In addition to oversight of the local Y, she is a board member of the Upper Midwest Alliance of Ys, the Wisconsin Out of School Time Conference Committee Chair, and a national YUSA food service delivery facilitator. Courtney Kermolis is the food program director. Courtney serves as the Lacrosse Area Family YMCA food program director and is responsible for the coordination of all food access related resources. Talk about social determinants of health. In addition to overseeing the daily operations of the program, she's also responsible for partnership cultivation. Courtney has partnered with the local Salvation Army and Hunger Task Force to provide meals throughout the community. She coordinates a team of volunteers and staff to deliver meals not only to 15 school-age care sites, but also over 11 other outreach locations to support those that need it most. Courtney leads her organization's efforts in ensuring children and families in their community have access to nutritious food. Most recently, Courtney established and grew the Y's first ever food pantry, which supplies food, hygiene products, and household goods to families throughout Lacrosse County. This summer, she's going to be overseeing the implementation of the new Y on the Fly mobile outreach program. Nancy Parcher is a certified community health worker for the Lacrosse Area Y. She works with referrals from the Lacrosse School District for families experiencing homelessness. Nancy supervises a team of 2 community health workers. Through her work, she's part of community committees, including the Cooley Coalition to End Homelessness, Community Youth Supports, and Wisconsin Community Health Network Committee. Nancy's previous work includes being a former Lacrosse County foster parent and respite provider, a former school nutrition service provider, former chairman of the Vision and Hearing Screening Committee, vacation Bible school teacher, and volunteer at a Christian day school. And then finally, we have Anna Stint, who's the mental health director. She's a certified advanced practice social worker that joined the Lacrosse Area Family Y team in December of 2022, so relatively new. However, she has over 15 years of experience working in a variety of settings as a social worker and community involvement in Lacrosse. As the mental health director, Anna provides staff training, mental health awareness, and messaging to the Y. Anna is involved in a variety of mental health outreach in the community as well, such as the Campaign to Change Direction, NAMI, and Alliance to Heal. Anna is leading the Y's commitment to striving for mental health excellence in the workplace. So thank you so much. I'm so excited to learn from all of you, and I'm going to hand it over.
Thank you. I just want to confirm you can see my slides and hear me.
You sound great. They look great. And we'll take questions at the end. So if you guys want to collect questions in the chat while things are going, we'll definitely have time to address this at the end.
All right. Well, thank you. Thank you so much. This is really a great introduction. Hope we can build off of what Lindsay has shared about social determinants of health. So today I'm representing the Lacrosse Area Family YMCA. This is just a little snapshot picture of all the work we do here at the Y. So I just want to set up, this is our little agenda for today. I'm going to kick off with an overview and then get into some nitty gritty and the great work that Nancy, Courtney, and Anna make sure happens at our Y. So just as an overview, the social determinants of health and thinking about how people, how they're raised, where the communities they live in, and how they're impacted is really important because our work at the Y is all about supporting our community. It's why we do what we do is to support our community, and our community, we care about the health of all. And so what's in it for a youth serving organization? We hope that you will hear some of that. The health of our community is our role. And so therefore that's why we need to pay attention to the social determinants of health. And so for us, as you'll hear, it's not just about the children. When we think about Wisconsin After School Network or out of school time are some words that we often use, we think about the children, but it's really about the whole family, which then can support the whole community. So just a little overview to work off of what Lindsay shared. The social determinants of health are the conditions and environments where people are born, live, learn, work, play, worship, and age that can affect a wide range of health, functioning, and quality of life outcomes and risks. And so you can see the Healthy People 2030 puts them into these 5 buckets of areas. And so wanted to give you this frame of reference so that you can see where our 3 big programs and efforts that we're sharing today fit into this work and really helping, build a better quality of life for all of our community. So we're going to kick off with our community health workers. Nancy's going to share about that. You'll see how they overlap and flow into food access, and then along with our mental health strategies woven into all that we do here at the Y. So, Nancy, I'm going to turn it over to you. You're up.
All right, thanks, Jenny. Can everyone hear me?
We can.
All right, great. And maybe you want to kind of help me with the slides as we kind of go through. So just to get started here, you can see on the screen here the different school districts in our area along with the United Way. So these are our partner organizations. We do receive referrals for families from the 3 school districts. Lacrosse School District is referring to myself and one other community health worker for families experiencing homelessness. And then the other 2, the School District of Holman and Onalaska, refer to another one of our community health workers for families whose children have chronic absenteeism. We partner with the United Way for some funding sources. They do training for community health workers. They manage reimbursements. And so when we complete some work with our families and have that highly documented, the YMCA here receives reimbursements from funders through the United Way. So that kind of explains this screen here. And then I think the next slide kind of shows our process here. So first of all, we find and engage with the family. And like I said, our referrals come from the school districts. And so they're identifying families that they see would really benefit from working with a community health worker, and then they send them our way. So when we first meet with these families, the first thing we do is assess their risks. We're really going through deep questionnaires about the whole family and how we can serve. We're asking health questions. Do you have doctor? Are your children up on their immunizations? Is there any chronic health issues? What does housing look like for you? What does transportation look like for you? We're asking mental health questions. We're doing ACEs screening, adverse childhood experience screenings. We're doing patient health questionnaires. We're asking, what does education look like? I've received several referrals for families whose kids aren't even enrolled in school because of their living situation. So that's where the access to education comes in. And sometimes the first thing we're doing is getting those kids enrolled in school. And then we're asking, what does transportation look like for you? Most of my families over the last couple of years have been living in hotels, and many of them have no vehicles. In Lacrosse, if you live within 2 miles of your school, you are not going to be provided busing. And so transportation is a huge issue. And so we're addressing that. We're finding out how we can help with that. The YMCA here, our community health workers have been at times giving kids rides to school. We've provided city bus passes. So we're really looking at, the whole child. And then, of course, Courtney's going to talk more about food access, but, we're not just asking, helping them apply for food share, but we're physically providing them with boxes of food here from our YMCA's pantry. We've also expanded that to clothing. We've got some baby gear, we've gotten diapers, we've got personal hygiene products. We've ran our own donations. We've got school supplies. We do a big school supply drive in the fall. And so we're really looking at the whole child, the whole family, and all of their needs. So then the next area is that plan and connect. Really a community health worker is well known in their community. We've made good relationships with all the organizations that serve the families. And so we're connecting them to all these organizations that provide support, all these resources. Um, and that's a huge component of our work, because it's not necessarily that we're doing all these things for them, but we're connecting them to the organizations that can help get these things done. And then we're monitoring their progress. We're checking in with them. We're doing monthly assessments, but we're really connecting them with more on a weekly basis. How is this going? You know, so many folks may apply for public housing, for example, or food share. But a lot of times you hear, well, I filled out an application, but I don't really know what happened, or I've tried to call someone and I left a message, but I never heard anything back. And so that's where we really come in, and, we know who to talk to in those organizations. We know how to speed the process up. We know how to make those connections with our families. Let's sit down together. Let's make these phone calls together. Let's see where you're at with your paperwork and your documents, and we're helping get personal identification is also a big one. Sometimes they don't have a driver's license, or maybe need a social security card, so we're helping them do that. But so this is an ongoing thing. We have families that we're working with 6 months, sometimes a year. um, all these processes take a long time, so we want to make sure that we're always engaged and monitoring that progress. And then finally, number 5, completion and reimbursement. Like I said, when we do these completions along the way, we are getting reimbursed, but we really don't discharge the family until we see that they are fully supported, that they have learned, we've empowered them now, that they are able to, they've taken control of their life and they're able to go on, and we've given them the tools now that they needed to be successful and to meet all the goals that they have. So if you want to change the next slide, Jenny, I'm not sure what's next. So yeah, here's me, and then 2 of my community health workers, Emily and Tina. Emily in the middle is our um, chronic absenteeism, CHW, and then Tina has an overflow of sort of mine with the families experiencing homelessness. And these are really the 4 core words that we like to use to describe our work: educate, navigate, coordinate, and advocate. So we're providing education on health issues. Um, maybe someone has diabetes and needs more education. What does A1C mean? How can I manage it? What does a healthy diet look like for me? Um, or maybe they have heart disease, and so we're providing lots of education on how to manage that and what that looks like. Navigate. That is, how I talked about, how do I navigate the healthcare system? It's overwhelming. How do I navigate public transportation? It's one thing to offer someone a bus pass, but it's a whole nother thing to um, navigate how do I use this public transportation, because that can be really overwhelming for someone, especially if they're new to the area. Coordinate. So this is where, we're connecting them to maybe your county health department, um, the school districts. We're connecting them to social workers in the school districts, anyone really that can help them. And then finally, advocacy is a huge part of our work. I've been working with our local homeless coordinator in the city and our mayor, and been actively involved in lots of meetings out in the community, and really just sharing the stories of what I'm seeing and hearing with the folks that I'm working with. So many times systems are set up and programs are set up, but if you don't really use those, you don't really understand that maybe they're not working as smoothly as they'd like to think. And so, I've been trying to be a voice for my families and saying, okay, this program was set up, but it's really not working. Here's the gaps that we're seeing and the needs of our families. And so advocacy is a huge piece of that. These are some pictures from our back to school drive, which was an enormous success. We did a fill the bus at Walmart and it was so full. They just kept bringing all these supplies, and it was overwhelming. And we saw these things coming in. We thought, man, I don't know if we're going to get rid of all this stuff. There was so much, and the response in the community was just unbelievable. We had many volunteers from a local college, and from our youth center staff here. It was just an unbelievable thing to see, and families were so appreciative. They got backpacks, and then they walked along through, and picked all the supplies that they needed. It was just wonderful. Just one of the things that we're able to do here at the YMCA. We're so grateful to have that.
All right. Thanks, Nancy. That's just a little bit of work around the community health workers and in the huge impact they make. We're going to transition into Courtney.
All right. Hi, guys. Can you hear me all right?
Yes.
Okay. All right. So I just wanted to kind of highlight our vision through the food program and our food access work. So we recognize that everyone deserves the opportunity to reach their full potential, and nothing is more fundamental to development than having consistent access to healthy meals. So that's kind of what drives my work here at the Y. Next slide, please. Okay. So the way that we are serving the whole child in our programs, as I just want to say, as we all know, that food access work is not always a one size fits all. So I wanted to highlight some ways that we do this in our programs to hopefully give you all some inspiration. I know that not every organization has a food program director or somebody who's dedicated specifically to that role. So just being aware that really anyone can do this work, and hopefully some of these ideas spark some, or some of these ideas are going to spark some inspiration for you. But all right, so we feed snacks or super snacks, which is kind of like a beefed up supper, to 15 before and after school programs and in our full day childcare. We are committed to ensuring that these snacks are well-rounded and nutritious. So all of our meals follow the school nutrition and USDA guidelines. We do this by incorporating as many fresh fruits and vegetables, milk, whole grain rich items, and protein. You can see in some of these pictures, that's my food crew packing up snack every day. We make sure that food goes out daily to these sites. And then some of the other photos are kids enjoying their snacks. We also participate in summer food service program at both of our Y branches and 2 area housing authorities that house the Boys and Girls Clubs, and then 12 other outreach sites. We also serve breakfast and snacks on non-school days called Kids Day Off, which is our non-licensed out-of-school time care. And we also want to make sure that we are focusing on children of all ages. So besides our school age care, our youth center, which primarily serves our teens in our community, receives food from our area food bank hunger task force, and they make a family style dinner every night to enjoy together. And then the newest addition, I guess, to our after-school programming is we have developed nutrition-based programming at all of our school-age sites to provide hands-on nutritional wellness-focused activities called Healthy Living Club. This after-school club provides hands-on exploratory-based curriculum that aims to educate about benefits of healthy eating and moving their bodies. So that's what you see in some of those photos. We did a pepper taste test to kind of get them introduced to some fruits and veggies that they may not otherwise, be interested in eating or have access to. We do some meal, my plate activities, and then also in that bottom corner is them making some protein balls. So that was very exciting to introduce to our programs this year. Next slide, please. All right, and as they mentioned earlier, we did start our first food pantry here at the YMCA. While it's still small, its impact is pretty mighty. So currently our best way to connect our community to this new resource is by bringing our pantry to them through mobile delivery. We work with our community health workers and youth center staff to identify families in our community that could use the extra support. Our food pantry has stocked shelves of groceries, toiletries, infant items, and school supplies, like you heard. And we also include menus for the families to reference and recipes to follow so that we can make dinner time a no-brainer for them. I did want to just kind of highlight some challenges, I guess, when putting together a food pantry. It's you know, I just want to make sure that everyone understands you can certainly start small. You do not need a lot of space to do something like this in your community or in your organization. We quite literally found a closet that wasn't being used, and we started organizing donations from just one single food drive that we had done. So just, you know, you can't pour from an empty cup. Make sure that you are just only biting off as much as you can chew. So. All right, and then also in those boxes, we do incorporate a monthly mental health newsletter that we call Food for Thought. It's a one-page resource that gives families prompts to help guide meaningful dinner table discussion, while also providing resources we have available in-house here at the Y and throughout our community. Our goal is to not only help provide what is on the dinner table, but strengthen what is around it. Having dinner as a family, as we all know, can help provide an opportunity for family members to come together, give a sense of belonging, and build better relationships, all while having meaningful conversations about their meal and the brain-body connection. Next slide, please. All right, Y in the Fly slash kind of our summer outreach efforts. We are committed to continuing our food access work throughout the summer when families need our support the most. Our goal is to find the best way to complement resources already available in our community by partnering with other organizations that share our same goal. So Y in the Fly, that's the vehicle you see, that's brand new to us. We've had the opportunity to take it out just once this year, and we're going to really gear up for a very full summer. It is a mobile initiative that provides healthy meals and enrichment opportunities and education to all, not just kiddos. So all children and teens, we believe, have the potential, but some may need additional support to reach this. So through focused programming and support, the Y is committed to closing both hunger and summer academic achievement gaps. The Y on the Fly will serve our community through 4 main areas of focus. Of course, food access, serving meals every single day, physical wellness, mental wellness, and then enrichment. Yeah, we just want to make sure that every child has access to these opportunities regardless of where they live. And we're going to do this by breaking down some barriers like transportation and costs, because this will be free to all. We did participate in an event a couple weekends ago, which is what you see in some of these photos. We had built make your own self-care journals, had some activities that are good for all ages, and then of course serving a meal every day. And then additional summer outreach that we do outside of Y in the Fly is that we still are serving at other or like in partnership with other organizations through our community, because unfortunately, Feeding America, I looked up the statistic, currently it's about 16% of kids in Wisconsin face food insecurity. So making sure that we are being mindful of that in the summer, because of course, a lot of those kids are reliant on that free and reduced meals during the school year. So being able to close that gap. Next slide, please. All right, and then food access work outside of those programs that I mentioned, we want to make sure that the whole family has access to nutritious meals. So we do this by collaborating with other organizations in our community to provide meals for people of all ages, because mom, dad, grandma, grandpa, other guardians, they need to have their full bellies as well. So we work closely with other departments within our Y and community to organize food drives, hygiene drives, and other volunteer and donation focused events. If possible, I highly suggest recruiting your community to help in your efforts, because this will provide these much needed meals and supplies, and it'll make sure that your work is sustainable and you can help those in need for years to come. Next slide, please. And then last but not least, I wanted to make sure that I took a minute to recognize the world of food access and feeding as many people as possible is definitely a group effort. You do not have to do it on your own. So combating food accessibility challenges requires definitely a community response. So I encourage your organization to brainstorm and reach out to other people in your community who share the same goal. We certainly could not do this without or have the reach that we do without the partners that you see here on the screen. We of course work really closely with our school districts. The Salvation Army provides lots of volunteers for us to get that food out the door each summer. The Hunger Task Force, like I already mentioned, is a local food bank that provides a lot of nutritious food that we can serve, and of course, Boys and Girls Club and, you know, all the rest of them. So whether you're just getting started or you're wanting to expand your program, make sure that you just allow the people in your community to support you. Yeah, the kids and families will thank you for it. So thank you. That's all I have.
Thanks, Courtney. You know, it's really, I just want to say too that a lot of the families that we identify with our food access work come from Nancy's team and really work in partnership with our community health workers. But there's a lot of other families that we identify in other ways or different locations through some of these partners that we work with. So, and now I'm going to turn it over to Anna Stint, who's our mental health director here at the Y.
Thanks, Jenny. Good morning. So yeah, I get the pleasure to integrate mental health work into Courtney and Nancy, and I'll tie that all together here. So our mental health vision at the Y, we are committed to supporting the mental health of all by providing opportunities to connect, educate, and collaborate to improve the mental well-being of our community. Go ahead, Jenny. So the areas that we mainly focus on in doing that work is social emotional development, social connectedness, and resilience. Social emotional development is teaching how to express, recognize, and manage emotions and how that impacts your relationship in your life. This can be from our youth to our adults are working on these. Emotions are often big and often hard to express, and we're here to help, you know, guide that from, like I say, our littlest members to our oldest members. Social connectedness is important for all of our mental health, and so we really try to, you know, bring these programs together and bring a social opportunity for those of our members to connect and gather. And then resilience, as much as we know life throws our challenges, and resilience is our ability to recover from those difficulties and challenges in life. And so how do we support people in that? This is, you know, since I started in December, been on my mind of how our mental health impact is at the Y and throughout then trickles into our community. So when we invest in mental health training and awareness and advocacy in our staff, that obviously trickles out to our programs and the members that we serve, which then impacts our community. Just as when we invest in that in our staff as well, that impacts our community, which then we know when our community is strong, we can offer some amazing programs too. So I just see this as a nice, you know, triangulation of support for all of this and that investment. And so I'm going to break down here how we do achieve that. And these are the main kind of 5 areas that we are looking at to incorporate mental health into. So the first one is staff development and training, and I'm going to put together with community outreach and collaboration. So the picture here is a partnership recently with our school district, the Boys and Girls Club and the Y, to provide training for our after school staff and youth center staff, and so that they have the skills when working with those youth. Also then, you know, collaboration to have these trainings out there and develop a skill set all together for that consistency. Other community outreach I've been having is with local organizations like Better Together, our National Alliance for Mental Illness, NAMI, working into our mental health coalition. We still have a change direction committee here, as well as we have a huge Alliance to Heal, and I'm not sure that those throughout all the state, but they're a substance abuse and prevention work group, but they have a prevention subgroup that I serve on, and that really focuses on mental health of our youth. Next area is program development. So as Nancy and Courtney already shared, you know, how I'm integrating in mental health resources, you know, the food for thought in Courtney's programs and getting those materials out. I often talk with staff, you know, just about how we can start small, as Courtney shared with food pantries, same as mental health. How do we plant those small little seeds or get materials out to people? Again, we're not, you know, looking at huge steps or huge gains. It's kind of looking at that 1% improvement and how do we do that within our programs, as well as my outreach. This is in a after school care program and working with our mental health coordinator there right now and how we can incorporate mental health activities into after school in that 3 to 6 time frame, and getting kids to express emotion, do activities around it, and incorporate that like SEL, that social emotional learning component. Also then I'm partnering, obviously we're all small department. And so how do I bring in more to support and get that outreach either? So working with AHEC and AmeriCorps to provide some intern opportunities so that we can continue to grow and get that outreach further. And then the last one is striving for mental health excellence in the workplace. Suzanne McCormick, the president and CEO of YMCA of the USA, wrote in a blog in early January 5th of 2023 calling caring for our mental health in our communities. In that, she has made a pledge with the American Psychological Association to strive for mental health excellence in the workplace. It looks at the 6 areas you can kind of see on this image on the left-hand side. And then on the right is how our Y is trying to work on breaking those down, from training to increase employee, options for flexible work model, looking at employee benefits and policies and work, equity, diversity, inclusion policies, as well as develop organization process and programs that help the mental health of all employees and in our workplace. And again, kind of tying back to my earlier image, that investment in our staff that trickles out to our programs and to our community at large. That's all I had.
All right, those are 3 highlights of our why. We have a large before and after school program and full day summer programs, but this is a little way to like go outside our box and do even more in our community for more families. So that's what we have. I can stop sharing the screen and can open it up to any questions that anyone might have.
Wanted to add one thing that I forgot to mention earlier. All of our families, when they start working with a community health worker, are receiving a free 3-month membership for the Y, which is also included in programs, which has just been wonderful. And what we've really seen in the community is that the Y here, it has a high level of trust with families. They may not want to always meet in a school or a county building, but they see the YMCA as a safe place. And that's just really been a huge benefit for us. We have a safe place to meet. We have a safe place for them to come, even if it's just to shower or use internet. It's just been such a wonderful benefit for our families.
Can you talk a little bit about how you helped, or like how you sort of maintain that or nurture that idea of it being a safe space? Because I think that's like a hard thing to do, is to develop trust with people. It's not something that happens overnight. It's not something you can just sort of declare is the truth. So I would love to hear more about how you nurture that.
Yeah, so when we first meet with the family, what makes us unique in the role of a community health worker is really, we are from the community. We are part of the community. And so finding a piece that connects you, maybe you have some lived experience. Hey, I was there, I understand. In just making them feel safe that this is not non-judgmental. It's okay. I understand. Those are huge, important conversations. That this is not to judge. I'm here to help you. I'm here to support you, and everything that we say is confidential. And I'm here to help you work on your goals. I'm not here to tell you what I think you should do. This is completely client driven. We are empowering our clients. We are lifting them up. We are building them up. And it's usually a relationship that grows. In the beginning, they're maybe, apprehensive to work with us because they're not really sure what the role is. And over time, we're really building that trust. And we have developed some beautiful relationships. and families that have just been in tears with just gratitude and thankfulness, and they do understand this is someone I can trust. This is someone who really gets it. You know, it's all about the language you use and the training that we receive. We are not coming from you know, high levels of education. You know, we're different than social workers, and I like to actually say that to my clients. I'm not a social worker because so many of our families have had negative experiences, and that's not to say anything against social workers. I totally support and work with a lot of them who are wonderful. Um, but we do like to sort of separate ourselves and say that, you know, we do have our own lived experiences, and this is a safe place for you.
Lindsay, I just wanted to flow off of that. I think that
Yeah.
as an organization as well, really working on our welcoming and inclusiveness in our building and visually. And so there we have a lot of visuals. We are intentional about our DEI work, and so that interweaves in creating that culture of a welcome environment. And then, of course, we have friendly people like Nancy and Anna and Courtney who are around to welcome, you know, people and, you know, really creates a great culture that we have in the organization. So um, I see there's a question in the chat box about how is this funded? I'm not sure if you're speaking specifically about one program, but you also mentioned how many of your staff utilize your mental health support. How do you maintain anonymity of it? Oh, I can't say that word. So Anna, do you want to take that question about mental health?
Yeah.
What that looks like for us?
Yep. So I just maybe a little clarification. So mental health based support, we're really looking at things from a community lens and how we, again, like Jenny was just saying, that approachability and truly meeting people where they're at. We're not necessarily, we're not providing, I should say, clarification on any skilled based therapies or different things, just as you would go to the clinic for you know, a medication, different things like that. We're still leaving that to our hospitals and other private agencies for any therapy-based supports. But we're looking at it very much as how do we, as staff at the Y, help people through that journey. Just as Nancy's saying, there may be those stigmas. We know there's a lot of stigma out there with mental health and specifically with those that have mental illnesses. And so how do we break that down and truly meet people where they're at? And my role in that is to help staff have the tools and the comfort to have those conversations and just be there as a support and come together as a community organization to build those people up. And we'll still leave the skilled to the hospitals or the clinics and wherever those people choose to go for that skilled therapy or whatever they need.
I can,
So
oh, go
go
ahead,
ahead,
Anna. I was
Nancy, if
making
you want to
sure
add more
kind of
to that.
the funding part of it. I was just going to say if we wanted.
Yeah, I was thinking the CHW funding in.
Yeah. Yes, so some of our positions are grant funded. My position specifically is through the school district through a grant. One of our other community health workers was funded through a different grant. And then we do receive these reimbursements through the United Way. It's all an evidence-based practice where we have a database that we use. And so every time, you know, we complete say we help someone get housed or we help them get their social security card, we receive reimbursements for those. And then you know, protecting someone's privacy has been huge. We don't use words like scholarships here at the YMCA. We use flexible pricing is how we call our membership fees, for example. But also, yeah, making sure that we protect that privacy has been really an ongoing, you know, conversation. For example, I've shared a lot of my stories and my work, which has resulted in a lot of money coming in for support. But I never use identifying markers when I speak about my families and or you know don't even use names. I'm just kind of sharing stories of successes that have happened because yeah, absolutely 100%, Michelle, I agree. We want to make sure that we respect all of our families. and I would can pretty confidently say that I believe we've accomplished that. And same thing with our food. You know, I'm physically taking a box with me in my car, so no one's really seeing where that food box is going.
It looks like, Courtney, there's some questions. I don't know if you could, do you want to take those about the menus?
Yeah, sure. Okay, so the question was, as far as the menus that I mentioned, what does that look like? How do we get that out there? So essentially, when we're building our boxes, we're using food that we have either gotten from our food drives or, of course, Hunger Task Force. So when we are putting together boxes, we're trying to put together meals that those ingredients could then be used for, instead of giving just boxes of lima beans and lots of pasta and, you know, the things that you typically see at food pantries. Of course, these menus or these recipes don't always, we're not able to provide every last ingredient. So when we're developing them, we're saying Monday through Friday. Monday is going to be taco bowl. The only thing that you may need to buy or supplement would be ground beef or cheddar cheese, tortillas, whatever it may be. And then also coming with the recipe to make that meal for the night. We had trialed that for a while, and I hadn't gotten a lot of feedback, so then I stopped, and immediately after I stopped, that's when I got all the family saying, no, we loved that. That was so helpful to us. And of course, we do have an application process, so we are aware of what kind of kitchen our clients or our members are working with. So we want to make sure that we're only providing food that is going to be useful to them, whether, you know, if they live in a hotel and they don't have a fully functioning kitchen, I'm not going to provide things that require a stove or, you know, like I said, pasta that can't be boiled. So just being really mindful of the food that we're providing for people. Our application process is very simple. We created it that way so that no one feels overwhelmed by it. It's definitely not an interrogation. It's just a way for us to kind of get to know the family, ages, how many people we need to provide for. And then we also do not ever turn anyone away. So yeah, and then as far as the making sure that we are being confidential and respecting people's privacy, I too, I guess, have lived experience with this. So I never want to make anyone feel any shame for using our services or, you know, anything like that. So we are making sure that we're always treating everyone with respect. We are delivering this to them in a way that is, you know, confidential. We're never sharing their information with anyone. The best way for us to get this, like I said, is to get it out mobily to them, but we do have people come to the Y and pick it up, and, you know, being very friendly to them, greeting them by name, I guess, in a private way. So just being, I don't know, mindful of that. Did I miss anything else from the question? I think that was all.
You got it. I see, Michelle, you asked about fundraising events, and I'll just, I'll take that a little bit. We are, you know, a larger, more organization, but certainly do fundraising. You know, our whole organization is funded and has a financial model where we have, you know, membership, and we have programs, and we have, you know, childcare programs and revenue, but we also have a big piece of our puzzle is fundraising and fund development. And so we do depend on, as an organization, you know, grants and funding. I'll also share this, that the Fill the Bus that Nancy talked about was actually News 8000 in our area. A news station was doing a Fill the Bus, and we got connected with them and worked with them to get the donation. So they did the really great hard work of Fill the Bus. And then we got to reap the benefits and get it out to the families. So really connecting with, you know, different partners in the community. But we do a lot of fundraising at the Y. We might have events, you know, we have sponsorships. We do like a giving day each year. So there's definitely a lot of fundraising that happens. Yes.
Sorry, I just wanted to mention one last thing that I had in mind was, so when we're talking about meals or food boxes or any sort of food access work, I have made it a point to make sure that we are calling it complimentary versus free. I think it kind of eliminates the stigma, gets people more inclined to want to participate in the services, so that we're not just handing out a free meal, but it's complimentary to anyone, regardless of who you are or where you come from. So that was the last thing.
Any other questions?
I would just share, this kind of goes off of the fundraising part, but it's been interesting to see when we have shared our work out in the community and the word has gotten out there, and our department has grown. We are receiving other types of donations. At Christmas time, our local Rotary provided free Christmas trees, and then we got tree stands, and in one of the slides you you saw pictures of handmade goods that were made by our local RSVP, which is our um, retired persons volunteering, making handmade hats, mittens, and baby blankets. It was really, it's been really great, and sometimes we're getting um, more donations in than we can handle, which is why we expanded our clothing pantry area. And so I have now totes and boxes full of clothing, which has just been wonderful. But it's interesting to see that when the word gets out in the community, people just respond. So I think that's the important part of sharing your work.
Great conversation. Thank you all. There's so many good ideas here, and some of them are, are sort of like larger undertakings and take time, and some of them are just little shifts in language that make such a huge difference in the way that people perceive your work, and establish that trusting relationship and really add a lot of sort of respect into the discourse. I'm really, really impressed and have walked away with a lot of ideas myself. Are there any other lingering questions? Seems like no. Thank you again so much for sharing everything. Really, yeah, really impressed, really inspired. Incredible. So we will take about 18 minutes for a break. We'll come back at 9:50 and we'll move on to our next presenter. So I'll see you all in a little bit and look forward to continuing and learning with all of you.